Signs of the potentially dramatic human health impact of the Gulf oil disaster already turning up on beaches across the Gulf. As the tar balls arrive with the tides, sickened oil spill workers are also making their way to shore for medical treatment. Let's talk about it with Dr. Manny Alvarez from the Fox News Medical A team. He got an up-close look at decontamination tents, West Jefferson Medical Center in Marrero, Louisiana.
In a board or a stretcher, we take all the gloves, everything comes off the patient.
That's
Anything that's on his skin, socks, shirt, pants, everything.
Everything.
So completely naked now here. Now he comes along, and what happens?
He sprays them down with the soap and water combination.
Okay.
And then uses his scrub brush and scrubs them down.
Okay.
Dr. Manny joins us live now with more. He is the senior medical correspondent here at Fox News Channel, head of the Medical A team. How many of those workers are they treating?
Well, you know, they started seeing a lot, especially when they started burning the oil. You know, one of the biggest complaints is that not only are they getting skin irritation, but also when they burn the oil in the 110-degree weather that they have down there, it gets into their lungs, it burns them, and of course, sometimes they need immediate medical attention. This particular facility has seen dozens of people. They're 2.5 hours away from the heart of the recovery phase of cleaning these beaches, and also they set up a facility very close to the beach there in Grand Isles to treat the most urgent of emergencies.
But I know you also went to a BP medical tent where they were trying to treat some of the workers and didn't have so much luck.
Let me tell you, you know, again, we're going to investigate this very hard because right now, after all these medical emergencies began to emerge, BP said, no, we're going to take control of the health care too, and basically they have told all of their workers that they need to go to BP facilities, which they're controlling, they're paying for. So the doctors in many of the hospitals in the area don't know exactly what's going on in the statistics, if you will, of how many people are getting sick, what are they seeing, and again, one of the biggest things about you know, healthcare crises is that information needs to be open and shared with other systems so that you know exactly what you're dealing with. So we have a main concern right now that we don't know all the facts exactly as to the toxicity levels that they're seeing in the field for these workers, and hopefully what impact that toxicity is going to have in the communities that are being exposed to these chemicals.
And it should be made clear, you're talking about, I mean, you were focusing on people who have been actively out there trying to clean up this oil. You're not talking necessarily just about somebody who's lying on the beach.
No, and let me tell you, you know, you can't lie on the beach right now. You know, these areas, these beaches are called hot zones. You know, if you go into them, basically you get sequestered, your clothes are taken away from you. You have to go to a decontamination BP site. So it's a very militarized type of environment. So they don't let anybody just wander off. And the key is, you know what the federal government is doing, because I heard that a lot of federal agencies are now looking at monitoring some of the side effects, which I predict could be quite significant.
What about breathing, for instance?
Well,
I mean,
you know, you go to these
vapor
places and you smell it. You stand on the beach and you literally smell the oil. As a matter of fact, a lot of the crews that were down with us started complaining of coughing. They have this dry cough that doesn't go away. And, you know, at the end of the day, you're talking about a toxic exposure that is going to be there for a long time, and so we better know exactly what's going on, so far as some of the side effects that we're seeing.
But it is fair to say, I mean, not every stretch of beach from Louisiana to Pensacola is closed. I mean, it's kind of hit and miss.
It's hit and miss,
is.
But look, in Grand Isle, which is a resort community where you have hundreds of homes there, and they're beautiful, and it's a beautiful part of the country, you couldn't see a single person except, BP workers, military, or sheriff's personnel, our news, of course, but there's nobody else there. All the houses are abandoned. We saw sign after sign in homes saying, BP, thanks a lot for ruining our beaches. I mean, all the communities are kind of very sad, and the mental health picture is something that we have to keep an eye on.
Dr. Manny Alvarez, good to talk to you.
You got it.
Thanks.